This is Dr. Wurzberger. Before we look at some video of arthroscopic surgery, I wanted to give you a perspective of what we would be looking at. In arthroscopy, we see the leaf and not the tree and not the forest. If you look at this picture of a knee joint with the kneecap removed, you can see the end of the femur, the upper end of the tibia, the cartilages in between the bones, and two ligaments crossing in the middle. That's fairly recognizable even if you're not experienced in medicine. This is something that gives a perspective as to what you're looking at. If we were to look at this skeleton with the knee bent over the table and two black dots where the anterior cruciate ligament attaches on the femur and in the tibia, that too gives a good perspective of what we're looking at. Even if you're not experienced in medicine or knee problems, you have a feel for that. Out of the blue, if we showed you this picture, you'd probably have trouble recognizing what you're looking at. These are the two black dots where the anterior cruciate attached, but we've come up so close on it that you don't have a perspective. And that's what I mean, you're looking at the leaf and not the forest. Keep that in mind while watching the video. This is a very beat up medial meniscus tear, which is what we call a bucket handle tear, where part of the meniscus comes out into the middle of the joint. Here it is right here, right in front of our scope. Now we'll take a probe and push it back into the position it's supposed to be in. If we take this probe and then push on it, it'll pop back to where it's supposed to be. However, depending upon the tear, you either have to try and repair it then, or you would remove portion. In this particular one, it was very beat up. If you can see here now where I have my probe through the body of the cartilage, and this is not repairable. It's too mangled. So we've got to take out at least a portion of it, and then maybe repair some of it, or if it just is not good, to take out this section that is displacing. So that's what we're doing here, is now detaching the front part of this, and unfortunately it does remove quite a bit of the meniscus, but in this case there really isn't any choice but to go ahead with this. So now we grab this piece of cartilage with this instrument and we'll just pull it out. Then we go ahead and look back and see what remains, trim it up a little bit, and be sure that there's nothing going to catch in the knee. So there's the remaining rim. It's a little beat up, needs to be trimmed up a tad, and then we'll be done. We'll go ahead and do a little bit more, but we'll stop the video now.